Hello, thanks for tuning in. Today we're going to discuss superficial intrinsic foot muscles. Those foot muscles consist of extensor digitorum brevis, extensor hallucis brevis, abductor hallucis, flexor digitorum brevis, and abductor digiti minimi. And these are considered your sore foot muscles. So today's focus is obviously to look at the myofascial trigger points of the superficial intrinsic muscles, and we also have to figure out why they're important. A common and often overlooked cause of foot pain. They can mimic sprains, ankle sprains, plantar fasciitis, and structural foot problems. And early recognition prevents unnecessary interventions such as surgeries. Objectives is to understand the referred pain patterns of these muscles, identify symptoms and differential diagnoses. These are very important because you're going to have patients coming in with these symptoms. You have to understand which symptoms are causing which are caused by which muscles. Learning activation and examination methods as well, and we're also going to review clinical management strategies. So, superficial intrinsic foot muscles refer pain only to the foot, not to the ankle or above. They can often be mistaken for ankle sprains when pain is actually muscular in origin. And the most troublesome trigger points when it comes to these superficial muscles are the trigger points that are affecting the weight-bearing areas of the sole. So your extensor digitorum brevis and extensor hallucis brevis. So these are the guys on the top of the foot. As you can see, the pain pattern's kind of at the dorsum of the foot, so it can almost mimic that ankle pain, that lateral ankle sprain. So it's always good to look into these muscles as well. And in children, it's the same referral as the adults. And this can also cause cramps in the foot, especially at the instep. The instep is up here. So if someone's complaining of cramps in this area, then you kind of know where that could be coming from. Now let's move on to your abductor hallucis, which is located right over here. This is your abductor hallucis. Pain centers along the medial heel, so basically spills into the instep and back of the heel. So as you can see, it's got quite a big referral, and it also refers right to that area where the plantar fasciitis referral patterns are. So whenever you have someone coming in with that plantar fasciitis pain, it can also indicate that it's the abductor hallucis that could be the problem. And in fact, it's responsible for about heel pain in about 10% of the cases. Now, abductor digiti minimi. So if anyone's having any pain on the outside of the foot for whatever reason, it's always good to look at this muscle right here. And here are the trigger points right in this area here. And you can see the pain is going to be at the aspect of the fifth metatarsal head. And it can also spill over into the distal lateral forefoot. Now, there's also the flexor digitorum brevis, which is the guy that's underneath, and this guy can give you that metatarsalgia type pain where people are experiencing pain along these. Often what happens, I find a lot of seniors get pain in here, and a lot of times their doctors tells them, well, the pain's here because of your loss of the fat pad, but in fact a lot of times it can just be this flexor digitorum brevis muscle that could be causing this pain. So it's always good to look at them. And that's where the trigger points are, right there. And this is the one that gives you that sore foot sensation. So if a patient's complaining of a sore foot, it's always good to look at these muscles as well. And 50% of the cases, this guy's responsible for sore foot. Now let's look at the attachment points. This is your extensors of the toes. So we got the extensor digitorum brevis and extensor hallucis brevis here. So extensor digitorum brevis and extensor hallucis brevis, their proximal attachments is superior calcaneus and nearby ligaments. And distal attachment, the extensor hallucis brevis is the proximal phalanx of the great toe. Right in there, it's responsible for that toe extension. Extensor digitorum brevis joins the extensor digitorum longus tendons to the second and fourth toes. And now we got the abductor hallucis, which is right in here, and it's subcutaneous along the medial foot border. So it's basically lines that medial foot border there. So it can be quite easily palpable. It's just you do have to press a bit harder. Calcaneal tuberosity, flexor retinaculum, and plantar epinerosis, distal the base of the phalanx of the great toe. And then we got the abductor digiti minimi, once again subcutaneous along the lateral foot border, calcaneal tuberosity, and lateral plantar fascia, and then at the base, inserts at the base of the fifth toe. You can see right in that area. Flexor digitorum brevis. This guy's right in the midsole. It's covered by the plantar epinerosis, and it covers the lateral plantar vessels and nerves. Proximal is calcaneal tuberosity and plantar epinerosis, and distal it splits at the proximal phalanx, allows the flexor digitorum longus to pass, and attaches to the middle phalanges of the second to fifth toes. You can see right in that area there. The function of the foot muscles. So overall, their role is to provide flexibility and shock absorption as well as balance. So that's why these guys work around the clock. Anytime anyone's walking for long distances or standing at work, these muscles are going to be the ones that can be the problem. And also ensures rigidity and stability for propulsion and gait, and stabilizes a foot at the subtalar and transverse tarsal joints during push-off. And when it comes to the EMG activity, it's increased in flat-footed subjects. This is why, so basically this contributes to arch support compensation. So when that patient's missing it, does not have a good arch support, what happens that these muscles end up taking the brunt of it. So whoever is flat-footed, they're more likely to suffer from sore feet, from plantar fasciitis, and this could be the reason why. And then we have also the abductor hallucis, which is linked to the hallux valgus, which is the bunion. So you can see if this guy becomes dysfunctional, what happens that this guy right here starts to protrude out, and then this guy tends to go in, leading to that bunion. So if someone does come in early onset of a bunion that's forming, you want to try and work on this muscle. Typical symptoms of these muscles is deep aching foot pain at rest, tenderness in the sole, often intolerance to orthosis or shoes, limited walking range, and limping gait. Active trigger points in the abductor hallucis, flexor digitorum brevis, abductor digiti minimi can cause severe foot soreness and may mimic plantar fasciitis. So these are kind of some of the main three guys that could cause that plantar fasciitis. Whereas the extensor hallucis brevis and digitorum brevis, they have the pain in the dorsum of the foot near the lateral malleolus, which can give people that ankle sprain type feel. Now let's touch up on plantar fasciitis. Heel and arch pain, policemen's heel, and it's probably because the policemen stand all day and they have very tough shoes which don't have any give. Which could be what's causing that inflammation. We know that's worse with first steps in the morning and worsens after activity. Some of the signs are tenderness over the medial calcaneal insertion, as we can see some of those muscles attached right in that area. Pain with passive great toe extension. So this is a good test to do, is you basically get that great toe into extension and see whether that causes pain. And calcaneal spurs are often incidental. Causes are often repeated traction to micro tears, inflammatory degradation of the plantar fascia, as well as increased tension and increased tension within those muscles that attach onto the plantar fascia. Risk factors are tight Achilles, overuse, and pes planus, so overpronation. So that puts people at increased risk. And that's why the Achilles is very, very important to always look and see how the calf muscles are, even though someone's suffering from plantar fasciitis. Best treatment at first is rest and activity reduction. Often what we do is we add stretching to the soleus as well as the gastrocnemius and the plantar fascia, and then we slowly maybe start to introduce some orthotics, some taping is good, and then NSAIDs. So cautious of steroid injections because it can cause rupture. And if you think about it, the plantar fascia is the one that always gets used when someone's walking. It's being utilized. So if it weakens, it is at increased risk of rupture. What causes these the trigger points to happen in these superficial muscles? Tight shoe restricts toe movement and overloads muscles, so there's no toe movement. So as a result of that, the muscles get tight. Immobilization after fracture where the patient has a cast. So anytime after that cast is taken off after 6 weeks, you want to try and work on these foot muscles. Any sort of trauma, and Morton's foot. So Morton's foot is this structure here where the second toe is bigger than the first toe. So that puts you at a higher risk of getting the trigger points. Hyperpronation, as we've discussed that. Inflexible shoe soles, these are all the things that can increase the chance of you getting the plantar fasciitis. Hard slippery surfaces where the toes have to work really hard. And then walking or running on uneven or sloped terrain. So these are some of the things that can cause the symptoms to get started. When it comes to the trigger point examination, when it comes to the superficial extensors, this is kind of where you want to try and see whether there's any tenderness or if it produces any sort of symptoms. We often use flat palpation against underlying structures. Patients jump response to tenderness in a taut band, so it can be quite painful. So when it comes to some challenges, the short toe extensors, they don't have much of a muscle bulk, so therefore they're not that easy to find, but you're just going to have to press around and try and find it. Flexor digitorum brevis is deep to the plantar punerosus, so here you're going to have to press hard. You're definitely going to have to use that thumb to be able to get into that area and press pretty hard. Abductor hallucis, so that's the guy that's a little bit more in this area here, around the arch. It's a thick muscles, but it does have deep fibers and you need firm pressure. And then abductor digiti minimi is obviously pincer palpation is usually the best, and that's the guy that's kind of on the outside. So that's how you'd almost kind of do a pincer like this and try and palpate that muscle to see whether it produces any of the symptoms or whether it's quite painful for the patient. So in summary, take-home message, intrinsic foot muscles can mimic any foot conditions. Referred pain patterns are localized to the foot. They don't go too much up into the leg or far up the ankle. Key symptoms are sore and tender feet, limited walking tolerance, and intolerance to orthoses, so custom orthotics. Common things that cause the trigger points to come on is number one is footwear. So whenever you get a patient that's coming in with these conditions, check the footwear. Hyperpronation, joint mobility issues, and then if they're doing their activities on uneven terrain. As we mentioned, requires careful flat or pincer palpation with the superficial muscles, and then deep pressure is often needed for the flexor digitorum brevis, as well as the abductor hallucis. When it comes to treatment, we want to work on getting those trigger points inactivated because that's the easiest thing that we can do. So we can do the hands-on therapy. We can also, shockwave can be very, very beneficial for this as well. Getting into those tendons and into the muscle bellies. And then also looking at to see whether support orthotics might be better, right? Assessing their footwear and also taping can be a good thing in the short run as well. Thank you for tuning in.